And finally, then we are going to look at the different types of weight loss surgeries. I do want to direct your attention to Blackboard, and under the April 14th, 16th MNT Chapter 5 and 6 module, you go to obesity, and then you can click on these gastric surgery animations if you want to look at some of the videos of what is happening here with the gastric surgery options. So we talked about weight loss medications, weight loss surgery. I don't have anything on the slide here because usually I have you do some research on the different types of weight loss surgery. But we have adjustable gastric banding. Okay, and that is when a surgeon will go in and place, I call it, I know this is simplified, but I call it like a ponytail holder that the surgeon is putting around a portion of the stomach. And then the surgeon goes in and inserts some saline into that band to make it tighter, and it's basically limiting the stomach capacity. So we go from our stomach, which can normally hold like 2 to 3 liters of food, to our stomach being the size of an egg. So it's just decreasing the amount of food that that individual can hold. And then we have a vertical, I could spell, vertical sleeve gastrectomy. And that is taking out a portion of the stomach. And then we have gastric bypass, which most of us are familiar with the gastric bypass. And that's where they're taking the small intestine and rerouting it to the very top portion of the stomach, and they're limiting the size of the stomach, just like in the adjustable gastric banding procedure. But with gastric bypass, we see a lot greater results with weight loss, but then we also see greater risks for complications and lifelong nutrient deficiencies, because we're skipping out on some of that small intestine. And recall from chapter 3, that's where most of our nutrient absorption occurs. All right, so that concludes our section on obesity. Certainly, if we were together, we could have a much more robust conversation regarding this, but your book does a nice job of outlining a lot of those treatments. Now we're going to move on to cardiovascular disease and some definitions here. Atherosclerosis, that's a plaque buildup in arteries, and heart attack, the medical term for that is a myocardial infarction. Risk factors for both a heart attack and atherosclerosis are having high blood cholesterol, high LDL cholesterol, and low HDL cholesterol, and having high triglycerides. This is the most common type of fat in humans, and if we're consuming excessive sugars, excessive starch, and alcohol in the diet, that can increase our triglycerides. We also see high triglycerides in someone that has uncontrolled diabetes or high blood sugars. And this is a circulating fat in our body, so we have almost unlimited resources for triglycerides. The critical issue is the type of fat in our American diet. We have more saturated and trans fats than we need. So remember, our saturated fat, that's our bacon, butter, creams, gravies, and our trans fats, that's our stick margarine, commercially produced baked goods. So what we want to do is use more of the unsaturated fat instead of the saturated and trans fats. Increase complex carbohydrates or fiber, that's going to help lower that LDL cholesterol, and then consume omega-3 fats. In particular, if someone has high triglycerides, omega-3 fats can be helpful for decreasing triglyceride levels, and it's also helpful for decreasing our risk of stroke. Okay, so in the past, there's been a lot of focus on the dietary cholesterol that we eat, but now we know that it's more the saturated fat and the trans fat that we eat that raises our blood cholesterol level more than the dietary cholesterol. Okay, so there still is, by the American Heart Association, the recommendation that our average cholesterol intake should be less than 300 milligrams, but the focus should be on decreasing saturated and trans fat. Saturated fat, between 7 and 10% of our